first Blue Sky session is a presentation from Chadia Wannous, One Health Senior Specialist and Global Coordinator for World Organization for Animal Health, WOAH. And I hope we have Tanawa Tianxin, who is Assistant Director General, Chief Veterinarian, Director, Animal Production and Animal Division, and Health Division, NSA, for the FAO, Food Agriculture Organization of the United Nations. Chadia, I'll give you the floor.
Thank you very much. Thank you so much. Good morning, colleagues. Thank you very much for inviting us to be with you here today, especially to Professor Claude. It's a pleasure to share with you some thoughts about our work and how we see this World Microbiome partnerships and summit contributing to One Health. So we start with the introduction about One Health. And you saw in some of the slides and also in our DG, Dr. Sobiran, welcoming remarks, the definition of One Health. One Health is not new. It has started long time ago, but the interest and recognition of its importance, it has gained momentum since the SARS outbreak, as Dr. Gao has highlighted in his presentation. And recently we asked our One Health high-level expert panel to define One Health for us. And they came up with this definition that it's an integrated, unifying approach that aims to sustainably balance and optimize the health of the animal, the humans, and the ecosystems. So we have the three main components here. Why? Because we recognize that we are all interdependent and we are linked. And this approach is mobilizing sectors, but also disciplines that work within these sectors, and mobilizing also communities at various levels. And you can see in the graph to the right, those communities, the society that we have to bring with us. So we need action not just at the high level, the international level, or the academia and the science, but also we need actions at the community level. And why One Health is important? One example is the increasing risk of pandemics. It used to be every 100 years we will have a huge pandemics, and then now it's this frequency is very much shortened to few years. And you can see how many large outbreaks we are dealing with now in the world. And there's some studies that show that the probability that we encounter a pandemic like COVID-19 is 2% in any given year. So in our life, we have the likelihood to experience another COVID-19-like pandemics, 38% chance. We know for sure that no one sector or no one discipline can address those emerging threats alone, and that's why we need the One Health approach. What are the drivers of those health risks? It's human activities. It's how we deal with our nature, from land use change to habitat fragmentation, to our forests, to our agriculture expansion and crop expansion, to livestock productions, and to wildlife consumption and trade. We also don't forget about the climate change and the biodiversity loss. And we have a lot of human and animal movement that it's hard to control, and we have issues with equity, poverty, and population growth. And importantly, we know that One Health is important, and we recognize it, but investment is very low. So we need to shift this thinking. And just some fact about this human activities, that human action have severely altered 75% of our terrestrial environment and 66% of our marine ecosystem. So it's a huge problem, and if we don't take action now and try to reverse this and prevent further damage, we will deal with the consequences, including increasing emerging infectious diseases. And to do this, we need systems, we need policies, we need procedures to help us bring those sectors and disciplines to work together. And this is what the One Health approach is offering. The benefit, of course, a lot of people, they say it's easier to work alone. And of course, it's comfortable to work alone. But the One Health approach is very cost-effective, very cost-beneficial to all of us. When we share resources, we reduce duplication and overlap of our initiatives, and we help the country and our communities to prevent the diseases, to preserve their ecosystems through this global and regional and national collaborations. So although it's difficult, but we need to do it because it's cost-effective and cost-beneficial. These are some examples of what the World Organization for Animal Health is doing to show its commitment to the One Health approach to confront those hugely complex and global health issues. Of course, we have our standards and guidelines, and then we do a lot of advocacy and policy development. We focus on science, research, and data sharing, and we do a lot of capacity building of our veterinary services to enable them to deliver on those commitments. For global collaboration, I will give an example of where WOAH is a key partners in the Quadripartite collaboration on One Health, which consists of 4 organizations, FAO, the Food and Agriculture Organization of the UN, the UN Environmental Program, UNEP, and the WHO, the World Health Organization, and WOAH, the World Organization for Animal Health. So we started long ago as 3 partners, but in 2022, we added UNEP to deal with the environmental component of One Health, and now we are the Quadripartite. And how we work together, we established strategic priorities for us, and those are the 4 priorities. The first one, we developed a One Health Joint Plan of Action. That's a framework to support countries to adopt and implement the One Health. And now we are in the phase of rolling out this joint plan of action at national level. And for that, we need, of course, all the support from the science and the research institutions. We work a lot on political advocacy to ensure political buy-in in One Health and also financial commitments. And we work mainly with political forums like the G7 and the G20, but also with many, many partners around the world. We work to mobilize resources for the One Health. And finally, we work to ensure that all the One Health actions are underpinned by science and evidence. And for that, we have our One Health high-level expert panel, but we also have collaboration with many institutions and networks like yours to support this efforts. So just examples of where the microbiome fit in the One Health. We see that this is a true One Health lens to study this interconnected system between animal, human, and the environment. And it's critical for us not just to address infectious disease, but also non-communicable diseases, food safety, food security issues, and climate change. And for animal microbiome, this is just an example, and I'm sure you will go through the working group now to more in depth into how animal microbiomes matter and why we need to take the One Health approach to address them. And this is just an example in production animals, how the gut microbiome is very important for their health, for their immunity, for how they absorb the nutrient, and how they are becoming a reservoir to zoonotic pathogens or AMR-resistant genes. And this will have an impact on our food security and food system, on public health, but also on the environment. This is an example from wildlife microbiome and the ecosystem. which is, again, another major area that the World Organization for Animal Health work on, and we have developed a framework for this. And we want to take into consideration the issue of how the environmental changes drive this imbalance or disruption of the composition of the microbiomes in the wildlife, and how this will alter the pathogen shedding or the spillover risk. And for that, we require, as Dr. Gao highlighted, surveillance, not just epidemiological, but genomic and metagenomic, and we need to do this across species to have the full pictures. So we see the microbiome as a living example of One Health because it demands integrated research, it demands harmonized surveillance across the sectors, and it demands that we have cross-sectoral policies. And I provided some examples from WOAH where we have some data that can help you to address those issues, including our World Animal Health Information System and our antimicrobial use database in animals. So our call to action is to strengthen the cross-sectoral, the cross-disciplinary collaborations, to engage the intergovernmental organizations like WOAH for evidence-based decisions. And in conclusion, we need to preserve microbial diversities. It's a global health issue. It will help us to build a healthier future, sustainable future for all of us. And for that, we need to work together. And we are very supportive of this collaboration with the World Microbiome Partnership. Thank you so much.